Good afternoon. My name is Dr. Sarah Arter, and I am currently an assistant professor at the University of Cincinnati College of Nursing. And I'm here today to talk to you for the next 15 minutes about enhancing nursing student clinical judgment, specifically in the classroom. Before I get started, I would like to take a moment to thank you guys for taking the time to listen to my teaching presentation. On the very last slide, I have some contact information if you want to follow up, if you have any questions or comments about anything in my presentation. So clinical judgment is currently a hot topic in nursing education, and rightly so. So my personal definition of clinical judgment is the ability to apply nursing knowledge that results in the best possible patient outcomes. NCSBN further defines clinical judgment as the observed outcome of critical thinking and decision making. They look at critical thinking and decision making as being cognitive steps that are not observable, but the outcome of those steps is observable clinical judgment. They also go on to talk about how clinical judgment is an iterative process, which means that it's very cyclical. You start with cue recognition and you work your way through all of those steps listed there. Once you get to evaluating outcome, based on your evaluation, you start right back up with cue recognition. And it's very similar to the nursing process. The reason that there is so much emphasis on clinical judgment, especially these days, is because better clinical judgment competency has been linked with better patient outcomes. So the more clinical judgment competency a nurse has, the more likely they are to practice nursing safely, which really makes sense if you think about it, because if you refer back to the past slide, those bulleted items are the steps that are a part of NCSBN's conceptual model on clinical judgment. And so clinical judgment, as you can tell, requires nurses to not only recognize relevant patient cues, but they also then have to take more steps after that into prioritize and intervene correctly and in a timely manner. And so that's a very complex process. The reason NCSBN has focused so much on it recently is because they're trying to match the NCLEX exam to try to do a better job of reliably and validly testing clinical judgment of new nurses. But right now, research shows that there is a current lack of satisfaction with new nurses' clinical judgment abilities among employers. So the research says that approximately 20% of employers are satisfied with new nurses' clinical judgment, which to me implies that as nurse educators, there's a lot of room for improvement for facilitating clinical judgment while we have these new nurses as students. So for the rest of this presentation, I'm going to take some time telling you guys how I have tried to facilitate clinical judgment in a pediatrics didactic course that I am currently teaching at UC. So these are the different interventions that I used in my class to try to facilitate clinical judgment. Some of them are more directly related than the others, but I'll explain more in depth with each one of those bullets on the next 5 slides. So I feel very strongly that a flipped classroom is a great teaching model for how we can better facilitate clinical judgment development in nursing students. So the way that I do a flipped classroom is that I assign pre-work to the students. And so before they come to class, they are responsible for new knowledge acquisition related to whatever topic we're going to learn about in class. So the knowledge acquisition part of it, which is an early step, should be done before they even make it into class. So what you're looking at on this slide on the left is a screenshot, and it lists all of the lectures that I have recorded. So students have access to these lectures, and they're able to listen to them before they even come into the classroom. In addition to that, on the right, you'll see it's just a little snapshot of a syllabus course calendar. And on that calendar are their reading assignments. So they have access to the pages in the textbook that they need to read, and they also have access to the lectures. So I know some students learn better through reading, some learn better through listening. And so they're really not required to do both, but they have access to both of them. And then that way they can use whichever one they learn better from. So once they've either done the reading or listened to the lecture or both, they can come to class. And the first thing they have to do at the start of class is they have to take a quiz. So we do this in a different way. The first class of the semester, I assign my students into teams. And so when they go to take the beginning of class quiz, the first part of the quiz they take individually. So let's say the quiz is 10 questions. They will take the quiz individually, all 10 questions by themselves. Once all individuals are finished taking the quiz, then they'll get together in their teams and they'll take the quiz again as a team. So once they finish with that, everything will be turned in. 50% of their points will come from the individual quiz, and then 50% of the points will derive from the team quiz results. So the whole purpose of the quiz, not that the quiz is going to necessarily help them with their clinical judgment, but it does hold them accountable for doing the prep work so that we really can spend the class time, doing more of those flipped classroom active learning strategies to do a better job facilitating clinical judgment. So once we're finished, then we can dive into the unfolding case study. So there's a lot of different active learning strategies that could be used, but this is one that I find to be very effective in a nursing didactic course. So on this slide, this shows a snippet of an unfolding case study that I use in a peds didactic course. This one has to do with congenital heart disease. As you can see, only a portion of the case study is revealed before each case study question, which gives teams of students the opportunity to discuss patient cues. They can generate different hypotheses about what they think is going on based solely on the information on hand. I really do believe that this is a more realistic presentation of information, and it pushes them to brainstorm what may be going on. And I think this mimics real-life nursing more than getting every piece of information right away. Think about the times, whether you work in the emergency department or you work in a hospital unit or even primary care, and a patient comes in, you don't get all of your information right at once. You kind of get fed spoonfuls of it at a time, and so you start to develop some hypotheses based on little bits of information at a time. And so that's how these unfolding case studies work as well. So as they're going through the case studies, they're answering their questions. Once they get to the end, once all of which they work in their teams for the case studies, once all the teams are finished with the case studies, then we will review the case study answers together as a class. So teams take turns answering the case study questions, and the teams are required not only to answer the question, but also to provide their thought process behind their answer. This is also known as think aloud. In doing this think aloud type process for answering the questions, I not only can tell whether they got the answer correct or not, but I can also figure out what their rationale is behind their answer. And this is where the clinical judgment development really happens. At least that's how I feel. So this picture that I have on the slide is a portion of the NCSBN's clinical judgment conceptual model. These were the same steps in clinical judgment development, or the cognitive steps of clinical judgment that I was referring to earlier. And I really try to base my case study questions around each one of these steps. By doing that, I'm able to ensure that the students are thinking through the entire clinical judgment process. So it begins with recognizing cues. And so maybe one of the first questions in the case study will ask the students to write down what are some of the cues that they're picking up on, or what are some of the pieces of data that they're getting from the patient assessment that they think are going to be pertinent to this scenario. So then the next question after that might revolve around, based on the assessment of your patient, what do you think's going on with them? And they might have to list like 2 or 3 different ideas or hypotheses of what they think is going on with the patient. And then after that, they'll have a question about judging the hypothesis. So that might ask a question, for example, which one of these hypotheses do you think is most realistically what's going on? Or something like, alternatively, it could be prioritize your hypotheses. So the team comes up with 3 different ideas of what might be going on with the patient. Now, what do you do with that information? Which should be the first one that you test out first? Why should you test that one out first? And then they have to come up with the right action. So what are some of the interventions that they can do to actually test their hypothesis to determine what is going on with the patient? And then they can, then they go down further in the case study and there's more information. And then there might be a question about evaluating the outcome. So you thought X was going on, you took action Y. What would be the expected outcomes from action Y? Thoughts like that or questions like that just to help them think through the entire process. So once we finish going over all of the case study questions and answers as a class, traditionally I would usually throw up maybe a handful of NCLEX style questions just so we can practice some of those in class. Thankfully, there are products out there through Elsevier, like the EAQs that they can do on their own time, so they get a lot of practice with traditional NCLEX style questions. But ever since I attended the NCSBN day-long seminar in Columbus back in the fall, I learned more about the next generation NCLEX style questions. And those are the types of questions that are specifically targeted to assess beginning nursing clinical judgment. And so I thought that would be a really good idea to try to weave in some of those types of questions into class to try to reinforce some of that clinical judgment competency. And so on this slide right here, this just shows one of those NCLEX next generation style questions. And this one takes information from the case study that we went over in class about Caleb, the little kid with the congenital heart defect, and it kind of moves along in the scenario. So this usually takes about 5 to 7 minutes for them to complete because they have to read the prompt, they have to look at the past medical history and the current labs and the assessment, and then they have to go through each line or each finding and they have to determine whether that finding is specifically related to the diagnosis, and if it is a potential improvement in the diagnosis or in the patient scenario, or if this indicates a worsening of the patient's condition, or if it's an assessment finding that's completely unrelated to the diagnosis in the prompt. So in this one, Caleb is a kid with a congenital heart disease, but it says specifically for this question that he is, in addition to being a kid with congenital heart disease, he's acquired community-acquired pneumonia. And so the findings are asking, are these related to the community-acquired pneumonia? Yes or no? And then if it is, you think, related to the community-acquired pneumonia, then does this indicate a potential improvement or a potential worsening of the condition? Okay. So I wanted to end this presentation with a quote, and this one comes from Sir Ken Robinson, who is an international educational leader known for his work in fostering creativity. So this quote is supposed to pertain to the fostering of creativity, but I felt that it applied equally to fostering clinical judgment in nursing students. And I believe that the teaching strategies that I've discussed in this presentation really do help create conditions where nursing students can further develop those clinical judgment skills and competencies. So I wanted to thank you again for taking the time to listen to this presentation. As I said earlier, if you have any questions, please feel free to reach out to me using any of the following contact information. Thanks again for your consideration, and I hope you guys have a wonderful rest of your day.